Ladies and gentlemen, you are warmly welcome to the part 3 of a Daniel Hayford's lecture series on the theme, an overview of adolescence and reproductive health. This lecture covers 5 important topics. They are care of the adolescent girl during pregnancy, labor, and the postnatal period, substance abuse among the adolescents, counseling adolescents, promoting adolescent reproductive health, and adolescent and reproductive health management program. Ladies and gentlemen, recall from the part 1 of this series of lectures that pregnancy among the adolescent population, particularly those who are under the age of 16 years, has several risks, and that those risks include obstructed labor, prolonged labor, and the consequent biological damage such as obstetric fistula. Did you know obstetric fistula is a biomedical condition in which a woman ceaselessly leaks urine or feces, which usually follows prolonged obstructed labor. It can refer to a hole or a defect which forms in the wall of the vagina, communicating with the bladder as a result of obstructed labor. In this case, the damage or condition is called vesicovaginal fistula. It can also refer to a hole or a defect which forms in the wall of the vagina, communicating with the rectum as a result of obstructed labor. This type is called rectovaginal fistula. In other words, fistula occurs when the vaginal tissues are crushed between the bony plate formed by the fetal head and the pelvic bones, and the pelvic bones for a prolonged period. I repeat, in other words, fistula occurs when the vaginal tissues are crushed between the bony plate formed by the fetal head and the pelvic bones for a prolonged period. This biomedical condition is more common among adolescents and pre-adolescent girls, as they are likely to have prolonged and obstructed labor due to their underdeveloped pelvis. Due to the endless leakage of urine and or feces and regular urinary tract infection or UTIs, victims of fistula have an awful body odor. This is one of the reasons their communities isolate them. The victims suffer deep psychological trauma due to their complete loss of status and dignity in society. The most painful moment of their lives is when they are rejected by the very husband or man who puts them in such a hurtful situation. Indeed, most of them are rejected by their husbands due to their failure to give birth. Due to familial and social rejection and their inability to make a living, the victims live for years absent any financial or social support. Many of them fall into life-threatening poverty. Adolescents suffering from this medical condition are supposed to be referred to a hospital where the fistula can be repaired. Yes, this biomedical condition is repairable. Let us spread the news and help many adolescents and other young people who are in hopeless situations. Ladies and gentlemen, take note of the fact that as part of the efforts made in the management of adolescent sexual and reproductive health, counselors are expected and required to educate and counsel pregnant adolescent girls on 1. Protecting themselves from malaria infection and other dangerous communicable diseases, especially those which are associated with anemia. 2. Prevention of mother-to-child transmission of malaria by making sure that they involve themselves in the intermittent preventive treatment or IPT program for malaria in pregnancy. Number 3, prevention of mother-to-child transmission of HIV. 4, eating balanced diet and nutritious food. 5, personal hygiene. 6, taking enough rest. 7, exclusive breastfeeding for the first 6 months and going on with breastfeeding as per the recommendation of the caregivers. 8, avoiding harmful traditional practices. And 9, recognizing danger symptoms in pregnancy, among other things. Did you know counselors who are healthcare service delivery providers make use of the Focus antenatal care chart or other similar or appropriate schemes to offer an antenatal care service for adolescent people? They encourage adolescent girls to deliver at the right health facility and assist them to work with a right supporter to develop a birth preparedness and complication readiness plan. It is recommended by several authorities that while offering care to adolescent people who are in labor, the health caregiver should be 1, loving or caring, compassionate or sympathetic, patient or easygoing, understanding or thoughtful or considerate. 2, should ensure that the adolescent person that they are serving understands what is happening and what the service provider does. Great. Furthermore, it is recommended that even though adolescent mothers do have the compounded task of continuing to create their own identity while they adjust to the role of being a mother, the counselor should do well to assist or support the adolescent girl to successfully take on the role and, for that matter, the responsibility of mothering. Dear friends of Daniel Hayford, another important thing that counselors are expected and required to counsel adolescent boys and girls on is the issue of substance abuse. Did you know there are various categories of psychoactive substances which are used by people around the world, including adolescent people? Psychoactive substances can alter the mood and distort the perception of people who make use of them. Examples of psychoactive substances are alcohol, cannabis, cocaine, heroin, nicotine, and petrol fumes. Indeed, it can be greatly challenging for adolescents to change an attitude, a habit, and behavior involving substance abuse, as these substances are stimulants and they can be addictive. And unfortunately, substance abuse can result in negative physical psychological, economic, social, and most significantly, health consequences for the adolescent population. Activities such as trafficking of the adolescent population and even migration of adolescent people on their own may end up exposing them to various forms of abuses. Such forms of abuse are sexual exploitation, forced marriage, early sexual initiation, early sexual activity, and so on and so forth. Yes, activities such as trafficking of the adolescent population and even migration of adolescent people on their own may end up exposing them to various forms of abuse. And such forms of abuse are sexual exploitation, forced marriage, early sexual initiation, early sexual activity, and so on and so forth. When adolescents which are involved in these unfortunate activities perceive their circumstances as hopeless, they may resort to using psychoactive substances as a way of escape. Parents, guardians, teachers, peer educationists, evangelists, public health workers, and adolescent counselors can help prevent psychoactive substance abuse among them through well-planned and executed education and support for those who desire to stop using substances. Yes, parents, guardians, teachers, peer educationists, evangelists, public health workers, and adolescent counselors can help prevent psychoactive substance abuse among them or among the adolescent population through well-planned and executed education and support for those who desire to stop using substances. Ladies and gentlemen, adolescent counseling is intended to help the adolescent people to make rational decisions and to cope with the circumstances they find themselves in. Like all other forms of counseling, it is a two-way communication process during which the counselor provides adequate information to the adolescent and helps him or her to evaluate their feelings regarding their problems. In addition, the counselor provides emotional support. Dear friend, it is expected and required of every contemporary counselor to understand that, I beg your pardon, dear friend, it is expected and required of every contemporary counselor to understand that counseling is not a process of giving solutions or instructions to the adolescent, and that there are two vital actors when it comes to counseling an adolescent. One of these actors is the counselor. The other actor is the adolescent person, who can also be referred to as the counselee. So, the two actors involved in counseling are the counselor and the counselee. Did you know the attitudes, habits, and behaviors of both the counselor and the adolescent could greatly affect the counseling process? The counselor is expected and required to develop an attitude, habits, and behavior which make it possible for the adolescent to relax and feel comfortable with him or her so that the adolescent can trust the counselor enough to discuss issues related to his or her sexual and reproductive health. The more an adolescent client can be made to relax and feel comfortable, the more likely it will be for him or her to express his or her sexual and reproductive health issues. This situation will make it possible for the counselor involved to effectively counsel the adolescent and serve the needs of the adolescent to a significant extent or completely. It is well known that when an adolescent person is face to face with a counselor, he or she may have various feelings. Such feelings may include shyness, anxiousness, embarrassment, and inadequacy to describe their problems and worries. When a counselor makes the desired effort to understand the feelings of the adolescent person, it fosters better communication between him or her and the adolescent. Circumstances which could encourage trust and a suitable relationship between the counselor and the adolescent include the fact that the counselor should, 1, allow sufficient time for the counseling, 2, show understanding, honesty, and willingness to help the adolescent, 3, express non-judgmental views, and 4, display confidence and professional competence. These are the behaviors which a counselor is expected and required to possess and grow to effectively respond to the needs of adolescents. My dear friends, it is good for a counselor to recall the acronym ROSE when counseling adolescent people. The acronym ROSE can be explained as follows. The R signifies the need for a counselor to relax the adolescent client or the counselee by using facial expressions which display interest. The O requires that the counselor should open up the adolescent client using a warm and caring tone of voice. The L requires that the counselor should lean towards the adolescent, not away from him or her. The E implies the need for the counselor to establish and maintain eye contact with the client. And the S stands for the fact that the counselor needs to smile. Dear friends of Daniel Hayford, the procedure for proper counseling of an adolescent person include 1, making a good, friendly first impression. 2, creating rapport during the first session. 3, giving simple information in a proper way. In the course of counseling adolescent people, a counselor may come across certain serious challenges which will necessitate the counselor to respond appropriately. Indeed, it can be particularly very challenging when the adolescent who is being counseled decides to go silent, cries, threatens suicide, and or talks at length concerning issues which the counselor do not perceive to be relevant. I repeat, In the course of counseling adolescent people, a counselor may come across certain serious challenges which will necessitate the counselor to respond appropriately. Indeed, it can be particularly very challenging when the adolescent who is being counseled decides to go silent, cries, threatens suicide, and or talks at length concerning issues which the counselor do not perceive to be relevant. Did you know a counselor who is counseling an adolescent person regarding sexual and reproductive health issues is expected and required to do the following? 1. Consider the age of the adolescent. 2. Consider the gender of the adolescent. 3. Be patient. 4. Ensure privacy. 5. Ensure confidentiality. 6. Respond to express needs appropriately. 7. Explore feelings and facts in an appropriate manner. 8. Encourage the adolescent person to identify or recognize possible alternatives. 9. Consider the probable advantages of the identified or recognized options. Number 10. Consider the possible disadvantages of the identified or recognized options. 11. Consider the possible consequences of the identified or recognized options. 12. Assist or support the adolescent person to make informed decisions or choices. And number 13, assist or support the counselee to properly plan how to execute the informed decision and or choice which the counselee has made. Ladies and gentlemen, there is a need for each and every one of us to recognize the fact that the key issues which relate to adolescence, adolescent sexuality, and their reproductive health could be handled proactively to a considerable extent. Such a thing can be handled to a considerable extent by promoting adolescent and youth reproductive health. Yes, such a thing can be handled to a considerable extent by promoting adolescent and youth reproductive health. Indeed, adolescent sexual and reproductive health promotion campaigns need proper attention in order to help protect our adolescent people from adopting risky attitudes, habits, and those behaviors which could badly affect their sexual and reproductive health. According to our authorities, we can choose to use various strategies to plan and to conduct adolescent-related sexual and reproductive health management promotions. Some of these strategies are: 1. School-based education. 2. Peer education. 3. Community conversation. And 4. Family life education. Accordingly, a counselor can choose to do such activities in schools, the community, and at certain workplaces. The kind of health promotion messages appropriate for adolescents depend on their age, their living arrangement, and whether they are in school or out of school. Did you know peer education is one of the important and effective strategies which are used to improve sexual and reproductive health outcomes of adolescent people through provision of the knowledge, skills, and beliefs which are essential to help people to choose to lead healthy lives. Adolescent family life education is also a great strategy for adolescent sexual and reproductive health promotion campaigning. It makes available important information on physical, mental, social, moral, behavioral, and mood alterations and development in the puberty stage of the adolescent phase. Furthermore, community conversation approach is a very important strategy which is expected and required to be used to raise the community people's awareness on adolescent sexual and reproductive health challenges to bring about positive attitudes, habits, and behaviors among adolescents. Did you know even early adolescents living with their own parents, sorry, did you know even early adolescents living with their own parents may still suffer sexual and reproductive health issues like child or early marriage, as well as early pregnancy leading to difficult childbirth with near future issues like obstetric fistula. This class of the adolescent population may also suffer sexual and related issues such as female genital mutilation or FGM, abduction, polygamy, and rape. Adolescents of the age group 15 to 19 years also suffer similar risks. Adolescents aged 15 to 19 years are more likely to be married in some societies, and in case they experience unintended and therefore unwanted pregnancies, they may resort to unsafe abortion. Such adolescents are also more likely to get STIs and develop the related diseases. Ladies and gentlemen, some of the critical issues which await the adolescents when they get to the age 20 to 24 years are unemployment, gender-based violence, or like rape and abduction, unintended pregnancy, unwanted pregnancy, unsafe abortion, avoidable safe abortion, as well as sex, and for that matter, sexual intercourse in exchange for money or gifts. Due to this situation, such adolescent people tend to suffer the greatest risk of STIs or sexually transmitted infections like HIV, syphilis, and gonorrhea. Dear friends of Daniel Hayford, in order for a counselor of adolescent people to effect positive attitude, habit, and behavior change among adolescent people, they should be considerably active in sensitizing local community leaders, religious leaders, as well as parliamentarians on adolescent sexual and reproductive health issues to help equip those people for advocacy on access to the right information and adolescent-friendly services. With regard to adolescent sexual and reproductive health program management, you ladies and gentlemen should do well to take note of the fact that adolescent sexual and reproductive health services can be delivered through various outlets. Such diverse outlets include health posts, health center, hospital, household, church, mosque, community, and the school. Did you know one needs to know the size of the target group for his or her adolescent sexual and reproductive health program? Such information could be obtained by means of well-planned and implemented household data survey. Classifying the target adolescent population by sex and age, such as early adolescents 10 to 14 and the youthful adolescents 15 to 19, is good sorry, is good for achieving several targets. I repeat, classifying the target adolescent population by gender and age, such as early adolescents 10 to 14 and the youthful adolescents 15 to 19, is good for achieving several targets, including 1. Planning tailor-made sexual and reproductive health information. 2. Planning tailor-made sexual and reproductive health services. 3. Calculating the use of services by age. 4. Calculating the use of services by gender. And 5. Monitoring progress of program operations and evaluating fees. Did you know there is the need for the management of adolescent sexual and reproductive health services delivery to know the coverage of their programs or projects? The coverage of such programs is an important indicator of operational outcomes and is considered a major determinant of the effectiveness or the success of the program. Such an adolescent sexual and reproductive health services delivery coverage can be calculated by dividing the total number of adolescent people using a particular service by the total number of adolescent people in the community in which the service is being rendered. Dear friends of the adolescents population, my dear friends of the adolescent population, my dear friends of the world's adolescent population, experts have indicated that there are certain key steps which are expected and required to be followed in organizing adolescent sexual and reproductive health services. Such important steps include 1. Carrying out needs assessment of adolescent sexual and reproductive health services provided at the health facility in the community or by a particular agency, organization, or establishment under consideration. 2. Documenting, identifying, or recognizing human resources and materials existing at the health facility, center, or agency under consideration. 3. Identifying existing problems encountered in providing adolescent sexual and reproductive health services for adolescent people in the area. 4. Developing proposals to help solve the identified problems. And 5. Presenting an action plan to execute the proposals. Take note of the fact that school-based adolescent sexual and reproductive health programs are planned in such a way that 1. They get tailored to the age of the adolescent group. 2. They could be implemented by means of associations, clubs, unions, societies, etc. On the other hand, community-based adolescent sexual and reproductive health programs are planned in such a way that they get tailored to both the age and marital status of the adolescent population. 2. They could be implemented by means of associations, clubs, unions, societies, and other legal associations. And that 3, they should involve different activities like peer education sessions and community conversations. Furthermore, it is recommended that adequate or ample information should be generated on the indicators of sexual and reproductive health program service delivery coverage, and such information should be employed in monitoring and evaluating the program success. I repeat, it is recommended that adequate and ample information should be generated on the indicators of sexual and reproductive health programs service delivery coverage, and such information should be employed in monitoring and evaluating the program services. Ladies and gentlemen, I am grateful that you have participated in this lecture. This is the last session, or the part 3 of Daniel Hayford's lectures on the theme, an overview of adolescence and reproductive health. Do well to ask questions, share your thoughts, and comment. Great. Thank you very much. Bye-bye.